For more, Dr. Rashmi Jain joins me now. She's a telemedicine pediatrician and the founder of babiesmd.com. Dr. Jain, welcome. Great to see you again. So the vaccines are bringing some much needed hope to this pandemic, but Dr. Birx said they will not save us from the current surge. What needs to happen immediately to save lives before these vaccines are rolled out?
Good afternoon, Tanya. It's nice to see you again. Yeah, this is a very scary time, with numbers rising inherently because coronavirus is a wintertime virus, and we tend to see the respiratory viruses surge in the winter. On top of that, we never really saw a complete settling down of the coronavirus in the summer. So now after travel with Thanksgiving, it's wintertime and people are more indoors, so they're kind of exposing one another. We really need to go back to those measures that we hear about every day, every hour. But that's the most important thing. We have to stay away from other people. We don't know who has the virus. We don't know if it was in our community, if it was somebody that we specifically may have known was asymptomatic before they actually became symptomatic. We have to make sure we're wearing our masks, and we have to make sure that we're washing our hands. So as boring as this sounds, as repetitive as this sounds, really the only way to even try and quell the pandemic and prevent these frontline workers from having to deal with hospital beds in the parking lots like you just showed us is to take our public health measures into our own hands.
And Doctor, leaders of Operation Warp Speed are saying the U.S. is on track to vaccinate 20 million people this month. Is that a realistic timeline?
So based upon what we're hearing, which is really exciting stuff, we may have emergency use approval for Pfizer this week and hopefully for Moderna next week. The FDA is meeting this Thursday and next Thursday. And if projected, they will be able to put out 40 million doses, so 2 doses for 20 million people. The first people slated to get this vaccine are going to be the frontline workers and healthcare workers. And there are about 21 million healthcare workers in the nation. That's, I think, a very important goal to try and vaccinate the people who are coming into contact with the virus day in and day out, especially as our ICU bed capacities decrease nationwide. After that, there's 3 million adults who are in nursing home facilities, and they would be the next to get the vaccine. So yes, I think 20 million people vaccinated in the next month with 2 doses would be spectacular. It's a great goal and a good start to the vaccination process.
And Doctor, you're a pediatrician. I want to ask you about schools. Pre-K and elementary public schools are reopening in New York City today. Do you believe this was the right decision? And should older children also be allowed to return to school? They are still having remote school here in New York City.
Yeah, that's a good question, Tanya. So the most important thing to remember is that thus far our research shows that children under the age of 10 may not be getting the illness as severely or as at all, actually. So not only are they not asymptomatic, they may not be getting it as bad as older children and adults. So right now, children over the age of 11 seem to be acting more like adults in how they get the disease, how they spread the disease, and the intensity of their symptoms. So the decision to make, to open up again the pre-K and the kindergarten through 5 in the New York school district is important because these children are losing out on valuable resources. In a lot of ways, how can a kindergartner or a first grader learn to read if they don't have that one-on-one or a small? Are parents equipped to provide that kind of tutorial for young kids who are already very excitable and all over the place? So this is actually already being done in Europe as well. The elementary schools are open based upon this research that we have now that is validating that children under the age of 10 may not be as much at risk of getting or spreading the disease. The issue in the school systems, though, is the adults, the teachers, the janitorial staff, the bus drivers. They need to be protected too. So we got to watch out.
And Dr. Jain, no one likes a lockdown. No one likes, the prospect of a lockdown, but 30 million people right now in California are under lockdown. And we haven't even seen the surge that that is expected from Thanksgiving. So do you think that most of the nation, at least the areas where they are seeing this type of surge, the surge that California is seeing, should also reset by locking down?
That's a really good question. So I'm in California, I'm in Southern California, and we saw this roll out this weekend. And, it comes down to the safety of the public. So when Governor Newsom made the decision to place these lockdown measures, so that we should only be with our household members, that, bars and restaurants should close down to indoor dining. It should be takeout and delivery only, things that we saw earlier in the pandemic, but we may not have thought would ever come back to haunt us again, I think are important. We don't know how fast and how close this virus might be to us. The ICU bed capacities in some of our counties are less than 12%. So 12.5% is what I saw last. And it's scary because we need to make sure that people, when they are sick, have the ability to get the medical help they need, have the ability to get the resources they need. And if all of our beds are full with COVID patients who are dealing with the intensity of the disease, what's going to happen to the people who have heart attacks? What's going to happen to the people who have pneumonias that inherently come about in the winter? We have to remember that the winter has people in hospitals normally for other reasons as well. So we should do our part to prevent spread of the disease. So as long answer to your short question, Tanya, I do think that we have to be very vigilant and possibly prepare for lockdowns in other nations that are facing such a rapid surge like we are in California.
All right. Well, Dr. Rashmi Jain, thank you so much for joining us. We really appreciate your time.
Thank you so much, Tanya. It's always a pleasure to be with you.